Hello, ladies. Thank you so much for joining me today. I'm very, very excited about this podcast, video cast that we are recording for Speak Your Heart, which is the first one and the first edition to be. And today, we are going to speak about navigating menopause across cultures. I'm very, very glad that I connected with you. I'm based in Singapore and both of you are in Dubai. So let me first introduce you to Dr. Hajra. So she's a family medicine consultant, women's health and menopause specialist. She's based in Dubai and have more than 15 years of experience. And we also have Kelli today with us, who is the founder of Tendamint and who is a menopause coach, and she empowers women across this journey. Welcome, ladies. Maybe we can start with Dr. Hajra, if you could introduce yourself.
Hi, thank you, Benedict. I'm really excited to be doing this podcast today. So yeah, I'm basically from the UK, although I have lived in Singapore for a little bit as well. And I have a huge interest in women's health and especially menopause. That sort of came on a little later. But yeah, it's been a very interesting journey for me. I used to work in a practice where there were a lot of women in sort of their early 40s to early 50s who were just felt really lost. My predecessor actually happened to be a menopause specialist. So it sort of led me to kind of embark on that journey and just supporting women going through the struggles of midlife and menopause, work struggles, relationship struggles, health related struggles. And, I think it's kind of enlightened me in many ways as well, obviously being a woman. So yes.
Cool. Thank you. What about you, Kelli?
Hi, thanks, Benedict. So I'm also from the UK originally. I left the UK 10 years ago to move to Dubai. I've since worked in other countries, was in Dubai 5 years, worked in other countries in sort of corporate leadership roles. So my background is in finance, law, consulting. But the reason I started Tendamint is purely based on my own experience a couple of years ago when something was off. I didn't feel myself and I really didn't know what was going on. No one really talked about menopause growing up. My mum didn't really either. And perimenopause was a term sort of I found out after going down many rabbit holes and realised that I'd probably been in perimenopause for the last sort of 5 or 6 years. So that's when I retrained, did my menopause coaching certification and lots of reading. And since then, I've been working with women to look at how they could better manage their perimenopause or postmenopause or whatever phase they're in through lifestyle changes, mindset, but also working with organisations and doing corporate awareness sessions and how they can support people in the workplace. So I'm very passionate about women's health and midlife in general. And obviously menopause forms a big part of that.
May I ask how the both of you met? Did you meet in Dubai?
We did. We met at a menopause event, funnily enough, didn't we, Hajra, about a year ago now?
Yeah. And we feel so blessed and grateful that we met because it sort of led us to obviously meet newer connections like yourself. And we also have this huge passion to kind of continue the work here and do a set of kind of women's related, content and things that women would definitely benefit from.
Well, I mean, for me, like myself, well, I'm half Senegalese, half Slovakian. I grew up in Japan and now I'm living in Singapore for a long time. So we are all the three of us are like, very different, but we have the same interest as well. For me, I'm not still in the perimenopause and I hope so because maybe I'm not really recognizing the symptoms neither. But I noticed that, compared to my 30s, the way I'm reacting before my periods, like the hormones, it's just getting crazier. So I feel a little bit bad to my environment, especially to my husband. But yeah, I think that it is very important that we get the necessary knowledge to recognize all these symptoms. Also, what to expect, because when I gave birth in Singapore, nobody really told me about postpartum. Everyone told me about, how delivery is going to be. And that was the end of the journey. So that's what I thought, but actually it was not the case. So I thought that now that in my 40s, I started asking questions to my mom as well, how she did live this perimenopause and menopause journey. And I thought it's very important to know about this, at least to have the knowledge and how we can prepare ourselves when this phase arrives. And also how we can prepare our surroundings. So because we are also like so different in terms of cultures, I got, like I was reading online that different ethnicities also respond in a different way. And I wanted to really hear from you professionals, is that really true? And what are the different impacts women face menopause depending on their ethnicity?
I'll kick off from sort of just a general thing. Culturally, women not only experience menopause or perimenopause differently, but also depending on their culture, can also be seen in a different light. So, in some organizations, then in some cultures, it's very, very taboo, even periods and things like that. So it can be seen as quite a shameful thing to even sort of talk about. But in other cultures, like in, some of the Asian cultures, like Japan, for example, there's a term that they use, I don't know if I'm saying it right, it's konenki, konenki, which refers to menopause, but it's seen as a natural life transition and so should be celebrated. And a lot of women in sort of Asian communities, as you get older, it's the wisdom that comes from that. Whereas in the Western world, age can sometimes be something that's looked at in a very negative way, and we need to try and change that. And women can experience different symptoms. And Hajra, from a medical perspective, you've probably got a lot more insight on that and with the patients that you've treated.
Yeah, no, absolutely. I think from the patients I treat, but also from some of the studies that are at the moment ongoing. So there's one particular study called the SWAN study, which is a study of women across the nation, which is primarily in the US. And it's obviously studying lots of different women, but obviously a lot of things have been picked up from that. So for example, Black women, they tend to have perimenopause slightly earlier than the white counterparts. And they also struggle with vasomotor symptoms a little bit more. So they tend to get more moderate to severe vasomotor symptoms. By vasomotor symptoms, I mean the hot flushes, night sweats, sleep disturbances. So, and then there's also other sort of social and economical problems that they tend to experience, especially in the US, some of them living in deprived communities. There's financial struggles, there's family responsibilities. So there's different things that have been picked up. Mental health is there, but maybe not openly discussed because mental health is a stigma and taboo in a lot of communities anyway. Many women don't like to come out and talk about it because they are they keep the families going. So if they break, then they're worried, that the whole family will break. So that's one of the things. But even amongst cultures, mental health is not openly discussed. There is stigma and taboo surrounding it. So we obviously need to have open conversations about that. And mental health gets affected in midlife and menopause directly from the hormones, but also from some of the symptoms that women have, the sleep deprivation, the sort of kind of knowing that, okay, it's the aging process starting, or loss of fertility, femininity. There's lots of kind of issues surrounding that. So that's one of the things that picked up. The other thing that's been picked up is that Latinas as well had faced the similar kind of issues. So, increase in vasomotor symptoms, earlier onset of menopause, and similar sort of social and financial and economic issues surrounding, menopause and quality of life. Asians, so we're talking about the Chinese, Japanese descent women, they have fewer vasomotor symptoms, but they are more prone to bone-related issues, so osteoporosis, although not fractures so much. But then you kind of look at, again, as Kelli said, their perception of, menopause as well. So they might be looking at menopause in a different light, but maybe experiencing different types of symptoms. They're also less prone to cardiovascular problems. Having said that, they do have high cholesterol, but they generally are, slim, quite active. And mental health wise, I think, again, as their perception's different, and maybe from an economic perspective as well, they might look at menopause differently. But certainly osteoporosis and joint related issues are a little bit more prevalent amongst them. Having said that, their diet is a little bit different. So they might have a little bit more, what we call phytoestrogens in their diet. So, more soy-based products. So those are the variations. I have missed one ethnic group out, which is the Asians, so the Pakistanis and the Indians. And they're a little bit similar to the Latinas and the Black communities, where they have more kind of propensity to cardiovascular problems, which we know gets increased around the menopause transition. As in we have a higher increase in cardiovascular disease and metabolic problems. But they tend to complain of more joint-related problems as well. And there's more obesity amongst this ethnic group as well. So sorry, there's a whole kind of variation in terms of different ethnicities and how menopause presents.
Is this widely known? I mean, this is really almost the first time that I'm hearing that different ethnicities are responding differently. The menopause, the symptoms are different. I'm wondering if ladies are aware about this, and do they ask questions like that as well?
And why don't you go ahead, Kelly?
Yeah, I think from my coaching experience, I'd probably say that 80% of my clients are more Western background. I don't get many from the Arabic culture or Indian because they feel uncomfortable talking about it. Or they feel that it's something they just have to get on with. They don't feel that that support is there for them. They shouldn't be moaning about something. It should be just something that they just get on with because their mum might have got on with it and everything else. But I think it depends, like all of us, we are from different backgrounds. We've worked in different countries. So our mindset and how we view things may be very, very different from someone perhaps who's in their home country who has not experienced living or working in different countries or cultures. So it really depends on someone's environment as well as to how they perhaps are more supported or whether they've had access to some of the knowledge. But I think as well with menopause, there's not been a lot prior to now, and thankfully there's lots of research going on, but prior to, was it the early 90s, a lot of the research was actually carried out on men with a lot of the medications and things like that. It wasn't really something that was hugely invested in. And I think now, because as a society, women are living longer, we are in the workplace, and the age that typically a woman would hit perimenopause could well be that they have young children, they've got a really successful career, they've got aging parents that they're also looking after. So you can imagine it's actually quite a stressful situation. So many women probably won't even recognise that they are experiencing perimenopause. So I think that sort of the takeaway from that is that we are also unique, that we have to all be helped and supported in different ways, whether that's through medication or lifestyle, diet or whatever. There's not one size fits all. And I think that's culturally, as a human being, wherever you are in the world. So I think we just need to be mindful of all of that.
Absolutely. I couldn't agree more with what you said, Kelly, that no two women will experience menopause and perimenopause in the same way. And that's why we need individualized management in terms of coaching or medication. And that also fits in with cultural variations. And, your question of whether women are aware, I think we're still kind of in that post-Women's Health Initiative era. And some women that I'm kind of surrounded by from different ethnicities, they might not be working, they may be more homemakers, they might not have access to, social media, for instance. So they might not kind of connect the dots. And also the fact that, for example, some of the symptoms of menopause aren't associated with menopause, so joint pains that a lot of Asian women struggle with. They would think it's arthritis or something inflammatory going on, or just, aging itself. But to kind of connect the dots is important to understand the full kind of spectrum of how menopause affects women. Again, knowledge and awareness is the first thing. But, and that's amongst, Asian women from the Pakistani, Indian backgrounds. In terms of like how, Black women, are sort of understanding menopause, they're fully aware of how it is, how it's presented. But I think there's other things to consider, and that's something I'm constantly surrounded by, and especially in the UK. I've worked in different communities, and I think it's more prominent amongst certain communities which may be slightly more deprived, and that's where lots of other things take over. economic struggles, family-related struggles, as Kelly said, looking after aging parents, children. And they really would put their own health and what they're going through, like, right at the back and, focus on, what's in front. But then we have to constantly counsel women and say, you have to look after yourself first before you look after others.
Absolutely. I couldn't agree more. Well, I mean, we touched base also like about the medical treatment that is available, right? Like I think that different countries, different cultures approaches it in a different way. But I would like to especially ask a question about HRT because I hear a lot about it. I saw my mom taking it. I think that and correct me if I'm wrong, there's a limitation of time that you can take this, but she took it for a longer time. So she was very, very young, very bubbly, like she had her period, even if it was like just for a few days, she was maintaining herself very well. But the day she stopped, I saw her just like everything crashing down. So I think that maybe that is the impression that I have. So if you could let us know a little bit more about this treatment. And also, do we really need to be scared about this HRT treatment?
Yeah. So, I mean, HRT has had a lot of bad press. And I mentioned the trial WHI, which is the Women's Health Initiative, which was 20 years ago. So a lot of the kind of negative perception has come from that, from both the user's perspective and the prescriber's perspective. So even myself, many years back, we were all a bit like, are you sure? But the products that were used in those trials, amongst women in those trials were different to what products we use today. And of course, just a little bit of a background about the trial itself. The women studied were older and they had other kind of comorbidities, which of course you would get naturally as we age. So there were lots of discrepancies. So obviously we moved on from now and we found a lot of benefits with hormone replacement therapy, from symptom relief to long-term health benefits as well, primarily osteoporosis risk and cardiovascular disease. And especially with that sort of window of opportunity or the timing effect. So the earlier it starts within the first 10 years of menopause, the better we sort of avail the benefits, the long-term benefits of hormone replacement therapy. And of course, we have to obviously understand that it's also given for symptom relief first, and then that comes as a secondary factor. So we don't give hormone replacement therapy primarily to treat any cardiovascular problems. It is used as maybe second line for osteoporosis management, but probably in younger women, it would be the first line. If women are at high risk of osteoporotic fractures, have osteoporosis, then yes, HRT is actually used in those situations. In terms of, when to start, the earlier women started, the better. And so again, that perception of menopause is when I have my last period or beyond that, perimenopause needs to be understood, and that's when symptoms begin, but women are still having their menstrual cycles. But that's probably a better time to start, because that's when symptoms come on like almost as a surprise to a lot of women. In terms of how long to continue for as long as the benefits are outweighing the risks. And that's literally that in a nutshell. So there's no arbitrary limit as to when women can stop taking their HRT, as long as the benefits are outweighing the risks, basically. So just 60, if women want to start taking HRT, let's say they've got symptoms or they've got other reasons, then it is the lowest effective dose. And if they want to continue, we do regular reviews and just make sure that they're on the lowest effective dose that's giving them benefits, both short-term and long-term.
I feel much better now.
Maybe Kelly might give us some more sort of insight into that.
Yes, please.
Yeah, I mean, from a personal perspective, I'm on hormone replacement therapy, and I noticed a huge difference probably within 3 to 4 weeks of me taking hormone replacement therapy. And some of the symptoms I had, I was very emotional. I've never been very emotional during any of my periods at all, so I would just burst into tears for no apparent reason. Just didn't have any motivation to do anything. Just that can't be bothered attitude. Which is very, very unlike me. And I just really didn't feel like myself at all. I wasn't really getting the hot sweats that everyone associates with menopause. I did have night sweats sometimes, but mine was just that feeling of just not being myself at all. So Hajra will probably explain the medical side, but the HRT now is body identical. So it's good for it basically replicates what our natural hormones would produce. So I have gel that I put on my skin. So 2 pumps, put it on in the morning, just like a routine now that I do. And then I take progesterone as well. So if you have a womb, you have to have both to protect the lining of the womb. But everyone's different, and there are different things, and different countries, like you say, you have access to different types of hormone replacement therapy. We're quite fortunate in the UAE that we do have the body identical transdermal gels and the progesterone, but we struggle with patches, don't we, Hajra? And vaginal estrogen is another one that we struggle with. So depending on where you are, and I lived in Thailand for a while as well, and again, I was quite fortunate that I could get access to the body identical HRT, but not all countries have the same access. So I don't know if you want to talk a little bit more about that, Hajra, around the different types.
Yes, absolutely. So yes, as I mentioned earlier, that the products are now different, and Kelly's kind of introduced that sort of aspect of body identical HRT, which is nowadays the first preference for most women. Majority of women now are started on body identical transdermal HRT because it's got a better safety profile. So transdermal HRT is basically the patches and the gels. And we've got other products in the UK as well. We've got sprays as well. But as Kelly mentioned, we don't have access to many of the other products here, but we are blessed that we've got these two, which are good enough and they're great. Sometimes we have sort of stock issues, but I think more or less I've been fine, which is great, and I hope it stays that way. We have a few other issues in terms of insurance companies, maybe not approving some of the hormone treatments. So sometimes women have to pay for it. So that's obviously some of the other caveats to that. So yes, as Kelly mentioned, the estrogen and progesterone is necessary for women with a womb because it protects the lining of the womb from being very thick, and that can lead to something called endometrial cancer or cancer of the womb. But yes, women who've had a hysterectomy for certain conditions, for example, fibroids, they might be able to take estrogen-only therapy. Progesterone does have, so of course we talk a lot about estrogen, which is essentially what depletes around the perimenopause and menopause. And that's where essentially replacing up to sort of physiological levels. Progesterone also has benefits in the sense that it's a bit of a calming hormone, so it helps with sleep. But it has other kind of issues as well that some women struggle with. But for the purpose of today's talk, we won't go too much into that. So that's basically, for women with a womb and without a womb. And then you've got the sequential and the continuous regimes that women take. So women who are in the perimenopause, who are still menstruating, will take the sequential regime because it sort of mimics that cycle. So they'll have a withdrawal bleed at the end of each month, and it kind of keeps things stable in that respect. But women who've not had a bleed for about 12 months and now are postmenopausal, they can have a continuous regime where they take estrogen continuously and progesterone continuously. So for the sequential regime, women would take progesterone for sort of 2 weeks and then 2 weeks off. And so that's basically, just mimics the kind of menstrual cycle, in that sort of cohort of women. And then women who are not menstruating, they will just continue to not bleed. And of course, that would be better for womb protection as well. And so that's a little bit about the HRT. There's lots to talk about. The body identical HRT products are very close to what our body produces, and it comes from the yam root. So, and it's regulated. So instead of like kind of looking at compounded products, I always tell women, get the ones that have evidence, that are regulated and are also body identical. So that's kind of what I tend to tell women. And we do see a lot of that here as well.
Hi, it's my first time hearing about the gel. It sounds like super easy to put, and then you don't feel it, right? You don't have to take anything orally, so that's really cool.
Just put it
That's
on, let it dry.
amazing, actually.
Yeah, let it dry, and then it's really super easy. And one thing I just will mention, and I completely forgot about this, is that one of the other things I struggled with is that I always wanted to go to the toilet a lot. I didn't have any infections or anything like that, but a lot of women think that this is not menopause related as well. And it wasn't that urgency where, as soon as you get in the door, you really need to go to the toilet, but I would just want to go all the time. And as soon as I started taking HRT, within 3 weeks, I wasn't getting up in the night to go to the toilet. I wasn't constantly thinking I need to go to the toilet. So, if there are women listening to this and they think they've got a urine infection or they've got bladder issues, yes, they may have. But if they're in a certain age group, it might well be that they're in perimenopause, and it's not something they have to put up with. Because what happens, and I had this back when I was in the UK, sometimes doctors won't look at it holistically. What they'll do, they'll look at one particular thing and they won't ask the right questions to find out, how are your periods, how are you feeling? And then, I went down a route of going to see someone about bladder issues and all of this sort of stuff. But I was clearly in perimenopause. So it's all these little things. So it's really important to keep a track of how you're feeling, symptoms. And when you do go to a medical professional, you have all of this information so a doctor can then make an informed choice. And it's important for women to feel empowered with the knowledge that they can then go to their doctor and say, well, actually, I think I may be perimenopausal. So it's really important for us, however old we are, because again, as Hajra said earlier, lots of young women think, oh, I don't need to worry about it. When, I just need to wait till I'm older. Well, no, actually, you need to find out now, because also you might have a mum, colleagues you work with, friends, even a grandma maybe. You don't know. Sisters, someone you think, oh, they don't see themselves over the last 6 months. They've not been who they used to be. They could actually be perimenopausal. So for you to understand that, then you can have those conversations, and it's really, really helpful. And the men in our lives as well, if we've got male partners, it's really important for them to understand how perimenopause can impact relationships, things like that.
No, absolutely. I think the other thing I would add to that actually is to not sort of like what I tend to notice, and I've noticed in the past as well, is that, there's a lot of this kind of desire to kind of over investigate as well. And of course, investigations stand where they are. If there's something that needs investigating, of course, by all means, you should. But, I see a lot of women, they've got joint pains and they'll get MRIs and various blood tests and kind of do a whole kind of 360-degree loop and you're back to where you are. So yeah, thinking outside the box, talking about the urinary symptoms is a huge thing, because especially post-COVID, a lot of our consultations in the UK, maybe not so much here. Thankfully, we still have a lot of face-to-face connections, but the UK is kind of very much shifting into telephone consultations, video consultations, and you lose a lot of the history from that. And that's my opinion. Someone who's complaining of urinary symptoms would then, maybe potentially have what we call empirical courses of antibiotics, which are actually, I think, might still be available over the counter in the pharmacies. Or, so you're getting antibiotics for a symptom that may not actually be an infection. So that's why it's really important to delve into what the actual problem is. It's not always an infection, and it may not always require the prescription of an antibiotic.
Would it be fair then to say that if we feel any kind of symptoms, the best place to go would be to a gynecologist first to talk about this, like, so that, if we are tracking our periods, or, we listen to our bodies and we have a joint pain, as you were saying, like, instead of going to see a joint specialist, I don't know, how do you call that? But is it better to go to a gynae and then maybe expose your problem, and then maybe from there could be a good start to see whether your hormones or level are good, or is it really like a joint problem, or is it like a perimenopause or menopause kind of symptom? Is that fair to say?
I think it depends on, sorry, Hajra, just jump in. I think it depends on the country you're in, and also the medical professional, because different medical professionals, although they might be a gynecologist, they might not have any experience of menopause. So that's in my opinion. So you could go, and even you could go to a GP, general practitioner, and they might not have that knowledge either. So I think from the community that I support, it's good to have that community and have those recommendations about, women that have been through this already, sharing your examples. And, you'll be surprised. People go, oh, I've had that, and they haven't openly talked about it, but this is what happened to me, and this is who I saw, and they were great. Or, I wouldn't recommend going to see this person, but actually this professional might be better, and they might be a little bit further away, but it's better to go and see through recommendations if you can in your circle, because everyone has different experiences. Hajra, sorry, from medical professional, what your thoughts?
I think this is probably less of a medical question. I think it's more of a personal choice.
Yeah.
Some people are so confident with their gynecologists. The only advice I would give is that as long as, the doctor is sticking to kind of evidence-based practice and giving a whole picture, and again, coming down to kind of respecting your views and what, the person wants in terms of management. So not sort of pushing treatment options, if the person is not wanting to go down the HRT route just yet, that's absolutely fine. You usually start with lifestyle therapy and gently kind of ease in the HRT if necessary. And sometimes women are just not ready to start hormone treatments. There's obviously a lot of, as we discussed, lots of beliefs surrounding hormone treatments. And I see that a lot more here because, first of all, there's this association of HRT with contraceptive pills, and hormone treatments in general. Just, I don't know, you just see a lot of women kind of saying, I don't want hormones. And because of obviously this perception of, maybe contraceptive pills affecting fertility, they're going to mess up with my hormones. But they are two different things. And HRT is not contraception. So let's just put that out there. You can still get pregnant whilst on HRT in perimenopause. So yes, in terms of who to go to, I think it could be a family medicine consultant or a gynecologist, but someone who has sound knowledge of menopause. And we have a lot of menopause experts nowadays as well who've completed menopause training through various bodies like the British Menopause Society or International Menopause Society. So that would be a great way to start. And that kind of leads me on to the next topic, which is education amongst healthcare professionals. So I think that's something that's definitely, I never got any training when I was in medical school. But I think medical students are now probably going to start to learn about menopause even in med schools and throughout their training. So by the time they do deal with women, I mean, that should be the case anyway. We shouldn't just always reach out to menopause specialists. I think we need to have an overall understanding of at least the basics of menopause, recognizing it, and maybe leaving the things to advanced specialists.
Absolutely. Since you're speaking also about education, I think that around me, at least in the company where I am, there's a lot of women who are working, but I'm very curious to understand how the working environment is also doing something for these ladies who are going through perimenopause. Since it is so taboo to talk about this, I think I'm a person who is more open. I would say if it was me, I would say it's too hot. This is happening to me. I'm not shy or afraid to speak up. But I think there's a lot of ladies who wouldn't even dare open their mouth or, take some medical leave because they cannot come to the office because of these symptoms that they are feeling. So how is that educational part improving? Is it improving? Is it still at the same level? Do we have more understanding in the working environment?
Yeah. So, workplace, again, it depends on where you are. So I think there is still a lot of stigma around menopause and the workplace. So, there's lots of studies going on, and there's one in particular in the UK that found that 1 in 10 women leave their jobs due to menopause symptoms. And about a third of those will actually hide their symptoms through fear of judgment, that they don't want to be thinking that of any less value or that they can't do their jobs, which is actually quite shocking, actually, when a lot of women within that age band are, running really good, successful companies or in high level roles. So that's a lot of experience that we're losing from the workforce. So some companies, particularly in the UK, there's a lot of work going on in the UK. Menopause friendly policies are being developed. But as the British standard in the UK, the menstrual standard, which now has a menopause aspect to it as well. So I think things are getting better. So it really depends on the work environment as well. There's office environments, there's more labour intensive environments. So they really have to fit the policies around different experiences and where women are working as well. But, simple things like flexible hours, and this would take account for, just normal menstrual leave as well. if women perhaps are having heavy periods during their perimenopause, or they need some more flexibility, they can have that in the workplace. Access to sort of quiet spaces. They just need, they've got that brain fog and they just need somewhere where they can just go for a walk or try to get that headspace back. But I think it's also trying to build awareness among not just the leadership team, but everybody within the organisation. And that's not just women either. Really getting people to understand that this is what can happen. This is how we support people. Building something into HR policies and having employer networks. So one of the things that I work with organisations on is not just the awareness, but also looking at menopause champions or, lunch and learns, or even like menopause groups. So women feel supported that they can go to those groups and have open and honest conversations, and they're not going to get judged by having those conversations. It's just having the freedom to be able to talk about it and feel that there's no stigma attached to it. And it doesn't have to be a big event. So some of the events that I've done with some of the organisations here in the UAE is we've done a lovely yoga session in the morning, and then we've had a breakfast afterwards, and we've just had very intimate conversations about some of the things that they might want to try around menopause. So it just depends on the organisation and how they operate and where they are. We don't have to make too much of it. We just need to try and normalise the conversation within the workplace to make it easier. And I think it will get easier as generations move forward as well.
Yeah, no, absolutely. And I think there needs to be an allowance of, better, maybe possibly more hybrid work and, days off if necessary, more maybe financial allowances, because similar to obviously, mat leaves and things. And even talking about maternity leaves, I mean, I'm actually quite disappointed to see some of those policies are not great in terms of how much time women get. And then postpartum, childcare as well after birth. They don't have great access financially as well. And even things like, for example, many women prefer to breastfeed. And I remember working somewhere and she was struggling to, find a bathroom to kind of express her breast milk. I mean, obviously we're going off on a bit of a tangent here, but we need to have even spaces within workplaces for women so they could, get some quiet space or, I don't know, express their breast milk. So, yeah, it was quite sad to see her sort of looking for a bathroom to express her breast milk.
I totally agree with what you're saying, and I'll be the first advocate to do that in my company as well. But I really believe that awareness is important, because if we keep just quiet, nobody will really know. And this is just a natural phase that we're going through. So, I mean, we have already shown through COVID that it's possible to work hybrid. So it's not because we are not able to go to office because we have such kind of like symptoms doesn't mean that we cannot work as well. It's just that we need an environment that is adapted to that as well. So yeah, I agree. We should be talking about this more and more, even if it's in smaller committees. But we need to do something, and we need to feel supported as well, because I feel it's so sad to hear that 1 in 10 women leave the company because of these symptoms that they're getting. I mean, we're capable. We should be able to work and continue as well. Why do we need to leave?
Exactly. I agree, Benedict, because I think, and some of those women probably don't, or haven't had the awareness, or haven't had anyone to support them to say, there are things that you can do to help. If they had someone to go to, then it would have changed so much. So yeah, education is a key piece. I think, again, there's another stat that was done a couple of years ago, and they said that 62% of women globally feel unprepared for menopause because of the lack of education. So we are doing the right thing now. We are.
But then kind of to educate other organizations like workplaces and various other entities, so that we all kind of work together. I mean, it won't work if we're just kind of talking about it and then other people are not kind of playing ball.
Absolutely. Well, I think like we can stay the whole night talking about, a whole life to talk about menopause and perimenopause. But if you could just like share one last word with everyone, that would be really cool and very, very, helpful for us.
I'll let you go ahead first.
Let me go.
Yeah.
I think I guess there's a couple of things there. I think the more we talk about it, the easier it gets. So that's in any setting, whether it's families, workplace. But I think education is key. Education is power here. I think the more we know and the better we can, look after ourselves and look after others as well. So I think those, talking about it and education would be the key takeaways for me.
Yes, I couldn't agree more. And I guess I would just follow on from that and maybe just mention that, and then having open and honest conversations with workplaces, with partners and healthcare professionals. And so once you understand the impact of what it is, then just to kind of express it so that each individual gets, the best care that they need. So I think that just follows on really.
Thank you so much, both of you. It was really pleasant talking to you. Hope to connect again very soon. But again, it was very insightful, very helpful, and encouraging at the same time. So thank you so much for your time. Enjoy your day, and we are
Thanks,
together
Benedict.
in this.
Yes, definitely.
Thank you so much.
Thank you
you,
very
Benedict.
much.
It was really
Thank you,
great.
Benedict.